Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. What is the first intervention for a client experiencing myocardial infarction? A. Administer morphine. B. Administer oxygen. C. Administer sublingual nitroglycerin. D. Obtain an electrocardiogram. The answer is option B, administer oxygen. 2. Which type of medications is commonly used to treat rheumatoid arthritis? A. Glucocorticoids. B. Non-steroidal anti-inflammatory drugs, NSAIDs. C. Antimalarial drugs. D. Gold salt. The answer is option B, non-steroidal anti-inflammatory drugs, NSAIDs. 3. A male client undergoes total gastrectomy, several hours after surgery. The nurse notes that the client's nasogastric (NG) tube has stopped draining. How should the nurse respond? A. Notify the physician. B. Reposition the tube. C. Irrigate the tube. D. Increase the suction level. The answer is option A, notify the physician. 4. Post-operatively, patient is expected to void after 6 to 8 hours, B. 2 to 4 hours, C. 12 to 24 hours, D. 10 to 12 hours. The answer is option A, 6 to 8 hours. 5. A female client has severe menstrual pain. Which of the following drugs you would recommend for this patient to relieve her dysmenorrhea? Ibuprofen, B. Zantac, C. Aspirin, D. Cortisone. The answer is option A, ibuprofen. 6. The nurse must suction a child with a tracheostomy. Interventions should include A. Encouraging the child to cough to raise the secretions before suctioning. B. Selecting a catheter with a diameter 3/4 as large as the diameter of the tracheostomy tube. C. Ensuring that each pass of the suction catheter take no longer than 5 seconds. D. Allowing the child to rest after every 5 times the suction catheter is passed. The answer is option C, ensuring that each pass of the suction catheter take no longer than 5 seconds. 7. A 40-years-old female complains of abdominal pain that it is worse after eating, especially if she has a meal that is spicy or high in fat. She has tried over-the-counter antacids, but they have not helped the pain. After examining her abdomen, you strongly suspect cholecystitis. Which sign on examination increases your suspicion for this diagnosis? A. Psoas sign. B. Ravsing sign. C. Murphy's sign. D. Gray-Turner's sign. The answer is option C, Murphy's sign. 8. Which pulse should the nurse palpate during rapid assessment of an unconscious male adult? A. Radial. B. Brachial. C. Femoral. D. Carotid. The answer is option D, carotid. 9. The most important nursing measure in the prevention of thrombophlebitis for the postpartum mother is A. Elastic stocking, B. Early ambulation, C. Anticoagulants, D. Isometric exercises. The answer is option B, early ambulation. 10. Which of the following is the best aid to prevent breast cancer? Teaching women about breast cancer, B. Public knowledge about chemotherapy, C. To eat fruits and vegetables only, D. Encourage women to perform self-breast examination monthly. The answer is option D, encourage women to perform self-breast examination monthly. 11. Which of the following factors would contribute to a high-risk pregnancy? Blood type O positive, B. First pregnancy at 33 years old, C. History of allergy to honeybee pollen, D. History of insulin-dependent DM. The answer is option D, history of insulin-dependent DM. 12. When the nurse puts an infant with high temperature in cold water in order to lower his temperature, she knows that the mechanism of heat loss is called evaporation, B. Conduction, C. Radiation, D. Convection. The answer is option B, conduction. 13. A child is admitted to the hospital with a diagnosis of Wilms tumor, stage 2. Which of the following statements most accurately describes this stage? The tumor is less than 3 centimeters in size and requires no chemotherapy. B. The tumor did not extend beyond the kidney and was completely resected. C. The tumor extended beyond the kidney but was completely resected. D. The tumor has spread into the abdominal cavity and cannot be resected. The answer is option C. The tumor extended beyond the kidney but was completely resected. 14. When assessing a 12-year-old child with Wilms tumor, the nurse should keep in mind that it's most important to avoid which of the following: measuring the child's chest circumference, B. Palpating the child's abdomen, C. Placing the child in an upright position, D. Measuring the child's occipitofrontal circumference. The answer is option B, palpating the child's abdomen. 15. The nurse is teaching a 45-year-old woman how to increase the potassium in her diet. The woman says she knows bananas are high in potassium, but she doesn't like their taste. What foods should the nurse recommend the client include in her diet? Carrots, broccoli, yogurt, B. Rhubarb, tofu, celery, C. Potatoes, spinach, raisins, D. Onions, corn, oatmeal. The answer is option C, potatoes, spinach, raisins. 16. When developing a plan of care for a patient with SIDH, syndrome of inappropriate antidiuretic hormone secretion, which interventions will the nurse include? A. Encourage fluids to 2,000 milliliters per day. B. Long-term fluid restriction. C. Monitor for increased peripheral edema. D. Keep head of bed elevated to 30 degrees. The answer is option B, long-term fluid restriction. 17. A client is admitted for treatment of the syndrome of inappropriate antidiuretic hormone, SIAD. Which nursing intervention is appropriate? A. Infusing IV fluids rapidly as ordered. B. Administering glucose-containing IV fluids as ordered. C. Restricting fluids. D. Encouraging increased oral intake. The answer is option C, restricting fluids. 18. How streptococci infection is transmitted from person to another. A. Airborne. B. Contact. C. Slandered. D. Blood. The answer is option B, contact. 19. A hospitalized client is found to be comatose and hypoglycemic with a blood sugar of 50 mg/dl. Which of the following would the nurse do first? Infuse 1000 ml D5W over a 12-hour period. B. Encourage the client to drink orange juice with added sugar. C. Check the client's urine for the presence of sugar and acetone. D. Administer 50% glucose intravenously. The answer is option D, administer 50% glucose intravenously. 20. A patient receives TPN. Which of the following nursing actions is important to minimize the risk for fluid volume excess? A. Increase diuretic dose if swelling occurs. B. Limit the amount of free water in relation to sodium intake. C. Monitor his or her skin turgor. D. Weigh the patient daily on the same scale. The answer is option D, weigh the patient daily on the same scale. 21. Which of the following findings would most likely indicate the presence of a respiratory infection in a client with asthma? A. Cough productive of yellow sputum. B. Bilateral expiratory wheezing. C. Chest tightness. D. Respiratory rate of 30 breaths/minute. The answer is option A, cough productive of yellow sputum. 22. When teaching a mother how to administer eye drops, where should the nurse tell her to place them? A. In the conjunctival sac that is formed when the lower lid is pulled down. B. Carefully under the eyelid while it is gently pulled upward. C. On the sclera while the child looks to the side. D. Anywhere as long as drops contact the eye's surface. The answer is option A, in the conjunctival sac that is formed when the lower lid is pulled down. 23. One nursing intervention for patient with asthma is to facilitate removal of secretions. This can be done by A. Encourage the patient to perform slow and shallow breathing. B. Encourage the patient to increase fluid intake. C. Encourage the patient to hyperventilate. D. Encourage the patient to decrease fluid intake. The answer is option B, encourage the patient to increase fluid intake. 24. The nurse is caring for a 6-year-old boy following revision of ventriculoperitoneal shunt. An expected nursing intervention is A. Request for an X-ray to evaluate shunt placement. B. Daily measurement of head circumference. C. Frequent palpation of the fontanelles. D. Maintaining the child in a prone position. The answer is option B, daily measurement of head circumference. 25. The patient have an itchy, erythematous, vesicular, weeping, and crusting patches on his skin. Which skin disease is this considered? Psoriasis, B. Impetigo, C. Eczema, D. Urticaria. The answer is option C. Eczema. 26. Giving an intramuscular injection to an infant in the gluteus maximus muscle may produce an injury to which of the following nerves? Femoral nerve, B. Sciatic nerve, C. Vagus nerve, D. Popliteal nerve. The answer is option B. Sciatic nerve. 27. Which of the following is one of the side effects of albuterol nebulizer? A. Hypertension, B. Hypotension, C. Fast irregular heartbeats, D. Tachypnea. The answer is option C. Fast irregular heartbeats. 28. A patient, age 49, returns from the post-anesthesia care unit after a total abdominal hysterectomy and bilateral salpingo-oophorectomy to treat cervical cancer. Which nursing intervention has the highest priority at this time? A. Monitor the patient for indications of hemorrhage. B. Assess the patient's pain level in response to analgesics. C. Encourage the patient to do deep breathing and leg exercises. D. Provide emotional support to the patient. The answer is option A. Monitor the patient for indications of hemorrhage. 29. When planning the care of a client who has undergone an abdominal hysterectomy, which nursing measure is most helpful for preventing post-operative complications and facilitating an early discharge? A. Re-establishing oral fluids and nutrition. B. Promoting ambulation and movement. C. Maintaining accurate intake and output. D. Exploring feelings about altered image. The answer is option B. Promoting ambulation and movement. 30. Which of the following is considered one of the common complications following abdominal total hysterectomy? A. DVT, B. Paralytic ileus, C. Constipation, D. Perforation. The answer is option A. DVT. 31. A client had a hysterectomy 10 hours ago. The nurse assesses the client and finds that her blood pressure has fallen abruptly. Which action by the nurse is most appropriate at this time? A. Continue to monitor the blood pressure every 15 minutes. B. Document the information on the client's chart. C. Inform the surgeon about the client's condition. D. Change the client to a Fowler's position. The answer is option C. Inform the surgeon about the client's condition. 32. The nurse is teaching a client regarding risk factors for stroke, CVA. The greatest risk factor is which of the following? Diabetes, B. Heart disease, C. Renal insufficiency, D. Hypertension. The answer is option D. Hypertension. 33. The nurse recognizes that the most common type of brain attack, CVA, is related to which of the following? Ischemia, B. Hemorrhage, C. Headache, D. Vomiting. The answer is option A, ischemia. 34. A woman comes to the clinic and states, "I've been sick for so long. My eyes have gotten so puffy, and my eyebrows and hair have become coarse and dry." The nurse will assess for other signs and symptoms of cachexia, B. Parkinson's syndrome, C. myxedema, D. scleroderma. The answer is option C, myxedema. 35. A nurse is admitting a 6-month-old infant with pneumonia. Which of the following interventions supports this infant's emotional needs? A. Allow the parents to leave the room during painful procedures. B. Encourage parents to distract the infant from crying. C. Interview the patents to learn the infant's comforting habits. D. Enforce strict visiting schedule and routines. The answer is option B. Encourage parents to distract the infant from crying. 36. A 43-years-old man is 30-hour post-operative following placement of a partial thickness skin autograft for a burn injury on the lower anterior leg. During a routine assessment, the nurse observes the wound is bleeding continuously. What is the priority nursing action? A. Use a pen to outline and monitor the area. B. Perform a wound swab for laboratory analysis. C. Incise and drain fluids from the wound bed. D. Apply firm and direct pressure for 10 minutes. The answer is option D. Apply firm and direct pressure for 10 minutes. 37. Coarse hair may indicate A. Dehydration, B. Inflammation, C. Undernutrition, D. Anemia. The answer is option A. Dehydration. 38. The nurse performs a home visit for a 32-years-old woman who had given birth to her first infant 3 days before. The mother has concerns about breastfeeding and the nurse observes the infant feeding. The mother sits supported upright with cushions and the infant positioned in a cradle hold. The infant's head and body are aligned against the mother's abdomen. The infant sucks intermittently with the lips turned outwards and the nipple in the mouth. Which intervention is most appropriate? A. Reposition the infant. B. Assist the infant to turn lips inwards. C. Ensure the latch includes the areola. D. Stimulate the infant to suck constantly. The answer is option C. Ensure the latch includes the areola. 39. A 52-year-old woman is scheduled to undergo an abdominoperineal resection in 3 days for removal of a cancer of the rectum. The nurse reviews the care plan with the patient. The patient will receive prophylactic antibiotics and will be given a mechanical bowel preparation the day before. Which additional preparation should the patient undertake at this time? A. Wear pressure stockings. B. Perform leg strengthening exercises. C. Maintain high protein, low residue diet. D. Take daily ferrous iron tablets. The answer is option C. Maintain high protein, low residue diet. 40. A patient is preparing for a scheduled hip replacement. Which lab value should be reported to the physician? Sodium, B. Calcium, C. Potassium, D. Magnesium. The answer is option C. Potassium.
Thank you for watching.